Bismillahirrahmanirrahim. Dear students, welcome to my new lecture, number 39. In this lecture, we will discuss about the anti-anginal drugs. So today my lecture is about anti-anginal drugs. So first of all, I will define anti-anginal drugs. So before anti-anginal drugs, I will clear the basic concept of angina pectoris, that what is angina pectoris. So as we know that angina pectoris as a clinical syndrome characterized by pre-cardiac pains or discomfort due to myocardial ischemia, which is precipitated by exercise and relieved by rest or sublingual nitroglycerines. It occurs when the coronary blood flow is insufficient to meet the metabolic requirement of the heart muscles. In simple words, you can say that angina pectoris is a medical term which is used for the chest pain, especially the discomfort due to coronary heart disease. Especially this case occur when the heart muscles doesn't get as much the blood as it needed. This usually happens because one or more of the heart artery, so it become narrow or blocked. So, and this condition is called ischemia. And this disease, there is a sort of, you can say, chest pain on the left side or discomfort due to coronary heart disease. In angina pectoris, myocardials, the strongest muscles in the heart, that is myocardiums. So the myocardial oxygen demand mainly it depend upon on preload, afterload, and heart rate. So as we know that myocardial's oxygen that is totally demand mainly depend upon on the preload, afterload, and heart rate. Now what is preload and what is afterload? Dear students, preload is actually, it is the initial stretching of the cardiac myocytes or the muscle cells prior to contraction, before contraction. So actually it is preload is related to ventricular filling, when your ventricle become filled with blood. The second one is afterload. So afterload, actually it is the force or load which is against which heart has to contract or eject the blood. Afterload means ejection of the blood. So afterload is the load to which the heart must pump the blood against. While the third one is heart rate. So that's why myocardial oxygen mainly it depends on these three factors. Another one is atherosclerotic angina, classical angina. These are the types of angina. One is angina of efforts, vasoplastics, or variant angina, prinzmetal angina, and unstable angina. So these are the types of angina as we have already discussed, and physiology, pathology, and that's why I always stress that most of the students they are not studying the basic physiology and pathology. So before studying the basic pharmacology, you must well have a little bit command on physiology. Okay, now let's come the determinants of myocardial oxygen consumption. So what are the determinants of myocardial oxygen consumption? So the first one is wall stress, intraventricular pressure, ventricular radius volume, wall thickness, and heart rate and contractility. These are the determinants of myocardial oxygen consumption. So I can take the example of MI, myocardial infarctions, and with there is occur death of the myocardium muscles, and with the myocardium muscle contractility become decreased, the heart become unable to receive the blood. So that's why the vasoconstriction occur. So these are the basic determinants of myocardial oxygen consumptions, like wall stress, intraventricular pressure, ventricular radius, volume, wall thickness, heart rate, and contractility. Come toward regulation of the smooth muscles, contraction and relaxation, that how the smooth muscles can regulates, how the smooth muscle can maintain its activity, how the regulation of smooth muscle contraction and relaxation take place. So in first case, how the smooth muscle they are regulated, the contraction and relaxation, these activities are maintained due to increasing CGMP, which is called cyclic guanosine monophosphate, and which there is as a result of deep phosphorylations occur up, especially of the myosin light chain and nitric oxides. As we know that our skeletal muscles, so they are contract and relax. So during contraction and relaxation, so these myosin, actin and myosin filaments, so they are activated. So especially in that condition, the deep phosphorylation of myosin light chains and nitric oxides. As well as especially in this case, there is occur decreasing the intracellular calcium level. In third case, there is stabilizations are preventing the depolarization of the vascular smooth muscle cell membranes. It means that as a result of increase the permeability of the potassium channels. In case number 4, there is occur increasing the CEMP, cyclic adenosine monophosphate, and muscular smooth muscle cell. CMP increase, cyclic adenosine monophosphate, so it increases the rate of inactivation of myosin light chain kinase. So actually these are the factors which are responsible for the regulation of smooth muscle contraction and relaxations. Now come to our drugs. There are certain drugs which are used in the treatment of especially in angina, organic nitrates and nitrites. So they are used nitrites in the form of sodium nitrites, amyl nitrites, and ethyl nitrites. Nitrates, they are also use glyceryl trinitrates, so they are also use isosorbide trinitrates and isosorbide mononitrates. So they are used especially in case of angina attacks. So these drugs are used, especially isosorbides, which can be taken, especially their drug can be put under the tongue, especially nitroglycerines, NG-sets, which is available in a market by trade name NG-sets. So it should be put below the tongue and the blood supply below the tongue, so they are greater, so that drug is absorbs and the condition become controlled. After that, calcium channel blocker, they are also used like nifedipine, verapamil, diltiazem. So I have already explained calcium channel blockers and antihypertensive agents. Beta adrenoceptor blockers or antagonists are also used. Beta adrenoceptor blockers include atenolols. Atenolol is available in the market by trade name टेनॉर्मिन, सो टेनॉर्मिन के नाम पे अवेलेबल है. इसके अलावा जो है और भी बहुत ड्रग्स हैं, ठीक है, 25-50 मिलीग्राम में अवेलेबल है. टेनॉर्मिन, प्रोपेनोलोल्स, अक्सा प्रेनोलोल्स. Xanthines, xanthine include theophylline, aminopylline, while the miscellaneous group that is called diphenyldimols. Drugs on drug groups under investigation for use in angina. So these are the drugs, for example, metabolic modulators. So these are, for example, ranolazines. The direct bradycardic agents, for example, ivabradines. There are some drugs which are available in the market, but some drugs they are still under investigation. Potassium channel activators, so they are also used, for example, nicorindils, RHO kinase inhibitors, fasudils, and sulfonylurias like glavenclamides, thiazolidines, and glitazones. So they are also available. Nitric oxide donors, for example, L-arginine, they are also used, capsaicin and amylorides. All these drugs they are used. Organic nitrates, so this is another group. So the pharmacokinetics of organic nitrates, glyceride trinitrate is a short acting, especially so actually glyceride trinitrate they are used in the management, especially management of angina pectoris. It can undergo fast metabolism if it is given orally. It can be given sublingually route of administration is sublingual, which is usually 500 milligram tablet per day. Onset of action so within 15 to 30 minutes. Its duration is 20 to 30 minutes, and they are usually mainly specially used in acute attack. Isosorbide diane-mononitrates, they are long acting. It can be given orally. Systemic availability is more than you can say GTNs. Used in prophylaxis treatment before the entry of microorganism. Now come to the basic mechanisms of the anti-anginal drugs. Organic nitrates, they can directly act by relaxing the smooth muscles of the blood vessels. So when the smooth muscles of your blood vessels should become relaxed, so it means vasodilatation can occur, and they occur in the following steps. The first one is denitration of the organic nitrates occur. The organic nitrates into they are converted into N-organics, while the N-organic nitrates they are further converted into nosonomine endothelium derived relaxing factor, LDRF. You can study it. After that, there is occur activation of the guanylyl cyclase, for example, rise cyclic guanosine monophosphate, and step number 4, there is occur reduction of the intracellular calcium concentrations, while in final stage there is occur relaxation of the vascular smooth muscles. So it means that after administration of these drugs, the smooth muscles of the blood vessels become relaxed and vasodilatation occurs. And when vasodilatation occurs, it means that the blood supply toward different organs should become enhanced. These are the pharmacological actions on cardiovascular system. So actually these drugs can reduce the preload due to vasodilation or vasodilatation, and it can reduce the afterload. I have already discussed what is the difference between preload and afterload. It reduces the afterload due to generalized vasodilatations. It can also dilate the coronary arteries and increase the blood flow to the ischemic area. Whenever the word come ischemic, so it means there is an inadequate supply of blood oxygen to that specific to that particular area, while others relaxation of bronchial smooth muscles, the bronchial smooth muscles should become relaxed, while especially the smooth muscle of the gastrointestinal tract, so they also become relaxed as a result of decrease the motility of the intestine of the GIT. There is also a relaxation of the smooth muscle of the biliary tract, urethra and uterus. These are other effects. Now come toward the indications. So as we know, these drugs they are also used in the management and treatment of angina. Clinical use or indication, these are the same thing. So they are used in the treatment of angina pectoris, as well as they are used in the treatment of congestive heart failures, as well as in myocardial infarction. So what will be what is actually happening in the myocardial infarction? There is occur the death of the segment of the myocardial muscles. So the death, when there is the death of the segment of the myocardial muscles occur, so it means that the blood supply toward that area become decreased and the heart become unable to pump the blood. The myocardial muscles contractility become weak and congestive heart failure. So these are the adverse effects which are reported by these drugs. So adverse effects, as I have already mentioned in my previous lecture, whenever in case of overdosing there is a flushing of pace, throbbing headache, there may be chances of throbbing headache if overdosing is occur. Postural hypertension, this is another conditions. So you know that especially in postural hypertensions, or you can say there is also called orthostatic hypertensions. So in postural hypertensions or orthostatic hypertensions, actually it is a certain drop of blood pressure upon standing, or you can say when the systolic blood pressure decrease of at least 20 mmHg or diastolic pressure decrease of at least 10 mmHg within 3 minutes of and standing position. So that's called postural hypotensions. Once again, I am going to repeat postural hypertension, that is also called orthostatic hypertension. So this is related to your physiology, but I would like to recall your previous knowledge. So actually, postural hypertension is a drop in blood pressure upon standing position. The third one is syncope. This is another ADR which is reported. So syncope is the temporary loss of consciousness caused by the fall of blood pressure, and nitrate tolerance may be occur. Contraindications. So these are the conditions in which these drugs cannot be used, especially organic nitrate intolerance. Especially in this condition, you cannot use it. Angina due to severe anemia. Whenever, let's suppose, if there is anemic condition, so these drugs they are strictly contraindicated. It cannot be used. While in case of high intracranial pressure, when the pressure inside your skull it become enhanced, become increased, so at that time you cannot use, especially in glaucoma. It cannot be used in glaucoma. Glaucoma is an eye disease, while in migraine. So in migraine, these drugs, these are also contra indicated. Another one is nitrate tolerance. So what is nitrate tolerance? So pharmacologically, nitrate tolerance during a long-term use, the nitrate effect is gradually lowered and finally resulting in partial complete loss of its benefit. Sometime we're using different type of medications, so due to continuous use or long-term use, that drug gradually decrease its therapeutic outcome, and ultimately there is partial or complete loss of its benefit. So it's called nitrate tolerance. The simple mechanism is reductions. It reduces the production of cyclic GMP, cyclic guanosine monophosphate, especially in the vascular smooth muscles. Nitrates pre-period of 1 to 2 hours every 24 hours. It helps in prevent development of tachyphylaxis. So this was all about the anti-anginal drugs. So kindly review this lecture, and if you have any question regarding my lecture, so you can directly contact on my WhatsApp. So I am always available for your services. Thank you so much, and inshallah in my next lecture I will discuss about the antiarrhythmic drugs. Thank you so much for watching my lectures.